NUR 355 Exam 1. Question 1. The patient with a substance use disorder, SUD, diagnosis may demonstrate which symptoms? Failure to fulfill major role obligations, recurrent use in physically hazardous situations, continued use despite persistent social problems, and withdrawal when the dose is decreased. Improved social functioning and interpersonal relationships. No physiological withdrawal symptoms whatsoever. Complete abstinence without any effort. A, B, C, and D are all correct symptoms. The individual who has a SUD may not adhere to an expressed plan to cut back on the amount or frequency of substance use. Question 2. The nurse recognizes which patient, S, are at risk for developing problems with substance abuse. The 14-year-old girl who is smoking/drinking after a move, the 17-year-old with untreated ADHD, the 32-year-old mother with a past history of binge drinking going through a divorce, and the 52-year-old executive who routinely drinks for back pain. Only the 17-year-old with ADHD. Only the 32-year-old mother. Only the 64-year-old recently retired man. All are at risk except the 64-year-old man who has limited/less risk due to his limited prior drinking history. The others have significant risk factors: stress, age of onset, untreated ADHD, family history, divorce, routine drinking for pain. Question 3. Which reaction in the brain results from drugs causing overwhelming surges of dopamine? Produce more of the neurotransmitter. Increase the number of receptors that can receive and transmit signals. Have increased ability to respond to any pleasure. Have decreased ability to respond to pleasure. Addictive drugs target the brain's reward system by flooding the circuit with dopamine. As a person continues hazardous use, the brain adapts to these chemical changes by producing less dopamine, reducing the ability to enjoy drugs and things that previously brought pleasure. Question 4. The nurse working in the pediatric clinic is performing substance abuse screenings on all children aged 12 to 18 as part of a community effort to identify at-risk teens. The nurse should consider which teen at greatest risk. The 13-year-old girl who has recently been irritable and moody. The 14-year-old boy being treated for diagnosed ADHD with prescription stimulants. The 15-year-old who recently entered high school and appears down, reports trouble sleeping, and has difficulty concentrating. The 17-year-old cheerleader who quits the squad, suddenly changes her group of friends, and has been acting very secretive at home. The 17-year-old cheerleader who quits the squad, suddenly changes her group of friends, and has been acting very secretive at home.